I'm going to be discussing influencing patients in private practice with the aid of the Choice Project YouTube videos to choose long-acting reversible contraception. I have no disclosures. Babies are precious. Whenever we see a baby, whether it's our own or it belongs to someone else, our hearts just melt. However, whenever we see this scenario, that of teen pregnancy, we're happy for this family. However, we do hesitate, even if it is just for a little bit, because we know that this mom and baby are going to struggle, even if they're surrounded by a supportive family. In 2015, the teen pregnancy rate in the United States was 22 teens out of 1,000 teens, accounting for almost 230,000 teen pregnancies. The teen pregnancy rate in the United States is far higher than in other developed nations. For example, in Singapore and the Netherlands, the teen pregnancy rate is only 14 teens out of 1,000. In Switzerland, only 8 teens. In North Carolina, the teen pregnancy rate is higher than the national average. It is 30 teens out of 1,000 teens become pregnant. And in Cumberland County, where I live and work, it is far higher than the national and the state averages. It is 43 teens out of 1,000 become pregnant. And the impact is great. 89% of non-pregnant teens will graduate from high school, versus only 51% of pregnant teens ever graduate from high school. And this is translated not only into a lower level of educational attainment, but also a lower income job and increased risk of the mom and her child living in poverty. You say to yourself, so what? That's her problem. No, it is our problem. Because in 2010, U.S. taxpayers paid $9.4 billion in the health care of teen pregnancies and the subsequent childbirth. We also paid $3.1 billion in the health care of these children. So it very much is an issue that we all need to be concerned about and we all should want to address. There is a solution for teen pregnancy. It is long-acting reversible contraception. This contraception does not require the patient's input in order to be effective. It is placed by the medical provider in the office in about 2 minutes with little to no discomfort for the patient. And it lasts for anywhere from 3 to 10 years, depending on which one she chooses. There are 2 subtypes. One is the intrauterine device, the device that goes inside the uterus, and it can be a copper base or a hormonal base, the progestin base, or patients can choose the subdermal implant that goes in the arm, and that's progesterone based. It is very easy to place, and it is covered by most insurances, including Medicaid. And what's even more fantastic about LARCs is that the failure rate is less than 1%, rivaling male and female sterilization. However, less than 6% of women in the United States choose this form of contraception. Studies have shown that the barriers to the uptake of LARCs is 1, lack of information, 2, misinformation, and 3, unfavorable attitudes towards LARCs. My project tried to address the educational barriers to LARC uptake. So what I did was I asked participants a series of questions about their attitudes towards the various types of birth control that are out there on the market. And then they were asked to watch 2 Choice YouTube videos developed by the Choice Project in Washington University in St. Louis, Missouri. The first video was a 4-minute video discussing the consequences that an unplanned pregnancy can have on a woman's life. The second was a 14-minute video discussing the advantages and the disadvantages of all the various forms of contraception on the market, from pills, the patch, the ring, the injection, the LARCs, and condoms. And then they were asked to answer a post-video survey of questions. The patient then chose which contraception that she wanted to use, and then the prescriber gave it to them. The goal of my project was to influence a large proportion of participants to choose LARCs as their form of contraception, with the ultimate goal that as more women chose LARCs, the rate of unplanned pregnancies would decrease, and ultimately teen pregnancy rate would drop. Every woman that came to the office was asked to participate. There were 32 participants in the project. And this chart is about the people becoming whether or not they were very interested in LARCs. Here you can see, sorry about that, okay. Here, right here is the contraceptive type in the x-axis, and on the y-axis is the percentage of those being very interested in the particular type of contraception out there. From this chart, you can see that as women watched the video, as participants watched the video, they became very interested, a lot more interested in the LARCs that are out there, including the progesterone and copper IUDs and the subdermal implant. But what is also that you know is that after watching the videos, participants became less interested in using birth control pills. This chart right here shows the participants' perceptions of whether or not they thought a particular type of birth control was highly effective. On the y-axis, you see the percentage of those who believed that a particular contraceptive type was highly effective. After watching the videos, we can see here that participants thought that the LARCs were highly effective after watching the videos, and then more importantly, they thought that the pills were less highly effective after watching the videos. This pie chart right here shows the participants' final overall choice in contraception right here. So, have to admit, as for a single choice of contraceptive type, we see here that pills was chosen the most at 22%. The subdermal implant came close to the pills at about 19%. However, when we look at the IUDs, combine the progestin and the copper T, we see that 15% of participants actually did choose them. So when we look at the total percentage of people who chose, participants that chose LARCs, we come up to a grand total of 34%, which is far greater than those who chose the pills and also the other forms of birth control that are out there as a grand total. Thus, I can conclude that we can influence patients to choose LARCs as their form of contraception, which is the most highly effective forms of contraception that are out there. And ultimately, this can lead to our grander picture that we want to reduce the unplanned pregnancy rate and the teen pregnancy rate. I learned a lot of lessons by doing this project and participating in the Kenoff Institute. I want my staff to be just as passionate about my mission and my vision as I am. In order to accomplish anything in the office and to be successful, I have got to gain their trust and respect. They have got to believe that what I'm promoting in the office is for their benefit and also for the benefit of patients. I also learned that I have to gain the trust of my patients. In order to do that, I have to listen, develop rapport, and trust from them. And this can be just as important as being able to convey accurate healthcare information. And finally, I want to thank the Kenoff Institute for allowing me to participate, and it allowed me to grow as a physician leader. Also, I really enjoyed meeting the fellow college participants and working with you during the retreats, and I wish everyone the very best in your endeavors. Thank you.